Imagine that your body is keeping a secret so big that even you don't know it. It's as if there's a little surprise growing inside you, but it's so quiet, so silent, that no one notices it, not even you. This is the mystery of silent pregnancy. Have you ever wondered what it would be like to be pregnant without knowing it? No strange pains, no nausea, nothing you'd expect. Only inside a new life is forming. And when you finally find out, it can be frightening because it's something unexpected and changes everything around you. It can be like discovering a hidden treasure, but along with it comes a whirlwind of emotions and responsibilities. I knew someone who experienced this. She thought she was just a bit tired, maybe a cold, but suddenly she realized she was expecting a baby. Imagine her surprise and fear at finding out so late. That's why we need to understand the symptoms of this very silent pregnancy. Because sometimes the biggest changes happen in silence. And knowing these signs can make all the difference both for you and for the baby on the way. Let's find out together what to look out for and how to pay attention to these little signs that the body can give us. Before continuing, just make sure you're already subscribed to the channel, because here we'll be bringing you a series of content that will help you through this pregnancy process. What is silent pregnancy? Silent pregnancy is a unique and surprising condition where a woman carries a baby in her womb, but the classic signs of pregnancy simply don't appear or are so subtle that they go unnoticed. To understand it better, imagine that the body is, in fact, creating a new life, but in such a discreet way that the woman continues her routine without realizing what is happening. In a normal pregnancy, the woman's body begins to show very clear signs in the first few weeks. Symptoms such as morning sickness, breast tenderness, extreme tiredness, and a noticeable weight gain are the first signs that a baby is on the way. In addition, the absence of menstruation is one of the most obvious signs, which usually leads women to take a pregnancy test to confirm their suspicions. However, in silent pregnancies, these changes hardly appear. Imagine a woman who continues to have monthly bleeding that looks like normal menstruation. She may feel some tiredness or a change in appetite, but these symptoms are so mild that they can easily be attributed to stress, poor diet, or even a cold. The belly may even grow, but in such a slow and subtle way that it seems more like a normal variation in the body than a pregnancy in itself. There are several reasons why a pregnancy can become silent. In some women, the pregnancy hormones may not behave in the usual way, which means that the classic signs simply aren't triggered in the same way. In others, pregnancy may be associated with pre-existing hormonal disorders, such as polycystic ovary syndrome, POS, which already cause menstrual irregularities and can mask the typical symptoms. In addition, silent pregnancy can occur when the placenta is positioned in a way that dampens the baby's movements, making it difficult for the mother to feel the kicks and movements that usually become evident in a typical pregnancy. A woman's own bodily perception can have an influence. If she is distracted or doesn't expect to get pregnant, she may not pay attention to small changes. One of the most intriguing aspects of silent pregnancy is that, in some cases, the woman continues to have monthly bleeding that resembles a menstrual cycle. Although these bleeds are different from normal menstruation, they can be mistaken for it, leading the woman to believe that everything is normal. This phenomenon can be caused by minor bleeding due to the implantation of the embryo in the uterus or other hormonal changes that do not completely interrupt the menstrual cycle. Common symptoms and signs of silent pregnancy. Unexplained fatigue. Extreme tiredness is one of the first symptoms of any pregnancy, but in silent pregnancy, this fatigue can be more moderate, almost like a common tiredness that many attribute to a hectic week at work or bad night's sleep. The woman may feel a little more exhausted than usual, but nothing that sets off alarm bells. It may seem like she's just going through a more stressful period, without realizing that her body is actually using extra energy to sustain a new life. Changes in appetite. Another clue the body gives is a slight change in appetite. Perhaps the woman feels like eating more than usual, or notices a change in her food tastes. For example, foods that didn't appeal to her before may seem more appetizing, or she may have an aversion to certain smells or tastes. But again, these changes are so subtle that they can easily be attributed to normal mood swings or even a phase of food experimentation. Have you ever heard of this sign? Let us know in the comments if you've experienced it, not least to help other women who find themselves lost at this time. Slight weight gain. Weight gain is one of the most common signs in any pregnancy, but in a silent pregnancy, this increase can be so gradual and slight that it goes unnoticed. It can be seen as a few extra kilos due to recent eating habits or lack of exercise. The belly can grow so slowly and discreetly that the woman only notices a slight swelling, perhaps attributed to fluid retention or the menstrual cycle. Subjective signs. In addition to these symptoms, there are other signs that are even more difficult to detect because they are very subjective. A woman may feel slight abdominal discomfort or mild cramps, but again these symptoms are often attributed to other conditions, such as indigestion or premenstrual syndrome, PMS. These little signs are like whispers from the body that are easily ignored or explained away by other causes. The challenge of detecting the signs. The subtle nature of these symptoms means that many women continue their lives without realizing that they are pregnant. The absence of more dramatic symptoms such as intense nausea or sudden changes in the body allows the pregnancy to continue undetected. In addition, the presence of bleeding similar to menstruation can reinforce the belief that everything is normal. These signs are like pieces of a puzzle which, when seen in isolation, seem harmless, but together could form a clearer picture. However, this picture is often only completed a long time later, when the pregnancy is already at a more advanced stage, or when the woman finally suspects that something different is happening to her body. This is why silent pregnancy can be so difficult to detect, requiring careful attention to the small details that the body presents. Listen to this true story. I'm going to tell you the story of a woman called July, who lived through the surprising experience of a silent pregnancy. July was 22 years old and in a stable relationship. She had always had an irregular menstrual cycle, so when her periods didn't come at the expected time, she didn't think much of it. July also didn't experience the common signs of pregnancy, such as nausea or significant weight gain. In fact, she only noticed a slight change in her appetite and a feeling of tiredness, but attributed it all to the stress of work and everyday routines. 6 months passed and July began to feel something different, but she still didn't think she might be pregnant. One day she decided to go to the doctor to find out why she was feeling so tired and had a slight abdominal pain. To her surprise, the doctor performed an ultrasound and revealed that July was 6 months pregnant. July and her partner were shocked by the news, as they had no idea she was expecting a baby. The fact that July had continued to menstruate, albeit lightly and irregularly, and had not felt the typical signs of pregnancy, meant that the pregnancy had gone unnoticed for so long. This late discovery changed July's life in an unexpected way. She and her partner had to prepare quickly for the arrival of their baby, who came into the world healthy 3 months later. This true story shows how a silent pregnancy can really happen, even when it seems impossible that something so significant could go unnoticed. Diagnosing a silent pregnancy can be challenging, as the typical signs of pregnancy are often absent or very subtle. However, there are ways to confirm that a woman is pregnant, even when the symptoms are not obvious. Blood tests. One of the most reliable methods of diagnosing a silent pregnancy is through a blood test that measures levels of the hormone HCG, human chorionic gonadotrophin. Even when the signs of pregnancy are not clear, HCG is usually detectable in the blood. This test can confirm a pregnancy from the earliest weeks, even before symptoms appear. Ultrasound. An ultrasound is another essential tool in diagnosing a silent pregnancy. While a woman may not notice any significant changes in her body, an ultrasound can reveal the presence of a developing fetus. It is possible to detect the baby's heartbeat and visualize its growth, even in the early stages. Physical examinations. During a physical examination, the doctor may notice changes in the uterus and abdomen that are indicative of pregnancy. Although less common, these tests can reveal physical signs of a pregnancy that the woman didn't realize. If you like this content, leave a like to help our channel and encourage us to always bring you new content about this beautiful period in a woman's life. And let's move on to the next topic. Menstrual cycle monitoring. Although irregular menstruation is common, careful monitoring of the menstrual cycle can help identify irregularities that may indicate a silent pregnancy. If a woman has cycles that continue but in a different way to normal, for example lighter or shorter bleeding, this could be a sign that something is going on. Urine tests. Urine tests are one of the most common and affordable methods of confirming a pregnancy. They work by detecting the presence of the hormone HCG, human chorionic gonadotrophin, in the urine, which is produced after the embryo implants in the uterus. Here are more details on how these tests work and their importance. How does the urine test work? The urine test is based on the detection of HCG, which begins to be produced shortly after implantation of the fertilized egg in the uterus. This hormone is responsible for maintaining the corpus luteum, which produces progesterone to sustain pregnancy in the early stages. Levels of HCG rise rapidly in the first few weeks of pregnancy, which means that the urine test is usually able to detect pregnancy from the first day of menstrual delay. Test accuracy. Pharmacy urine tests are very accurate, with a hit rate of over 99% when used correctly and after the expected period of menstrual delay. However, accuracy can be lower if the test is carried out too early, before HCG levels are high enough to be detected. In some cases of silent pregnancy, the HCG level may be low, which could lead to a false negative result. How to perform the test? To perform the test, it is recommended to use the first urine of the day, as this contains the highest concentration of HCG. The woman should urinate into a clean container or directly onto the test strip, depending on the type of test she is using. After a few minutes, the test will show the result, which is usually displayed in the form of lines, crosses, or words such as pregnant or not pregnant. Interpretation of results. Positive. If the test shows a positive result, this means that the HCG hormone has been detected in the urine, confirming pregnancy. Negative. A negative result indicates that HCG was not detected. However, if the woman still suspects pregnancy, she can repeat the test after a few days or consult a doctor for more detailed tests. False results. In rare cases, a test can give a false positive, due to the presence of HCG for other reasons such as some medications, or a false negative, if the test is done too early or if the urine is too diluted. Emotional impact. Finding out about a pregnancy so late in life can really mess with a woman's emotions. It can be shocking, frightening, and difficult to process. In addition to the physical impact, the emotional impact is also great, because the woman needs to adapt quickly to the idea of having a baby on the way. This is the world of silent pregnancy, where the body keeps a big secret that is sometimes only revealed at the last minute. It's an intriguing and surprising condition that reminds us how mysterious and complex the human body can be. It's a phenomenon that defies our expectations and highlights the importance of being attentive to the little signs that the body can give. For many women, understanding that pregnancy can occur without the classic signs is crucial to making informed decisions about their health. This reinforces the importance of regular visits to the doctor and the use of appropriate tests to confirm a possible pregnancy. Ultimately, silent pregnancy reminds us that every body is unique and that we should always pay attention to what it is communicating to us, even if in a subtle way. If you like this content, subscribe to our channel and you'll be giving us a lot of encouragement. Big hugs.